As been said, I'm with the University of Glasgow. I'm doing my PhD. It's an interdisciplinary PhD. So I focus on education, community engagement, and the control of zoonotic diseases. You guys know what zoonotic diseases are?
Yes, no guys?
Come on, I need the response. I need you guys to say something. We're going to be talking. Do you guys know what they are?
What?
Huh?
What is what?
Zoonotic diseases. Do you have any idea? Okay.
No.
Okay, they're the diseases that move from animals to humans, right? So they affect both humans and animals. So that's what I actually do. But in Malawi, I was working in the civil society, so in the NGO sector, doing some development and community engagement work. But I also worked for some universities. I was working at the University of Malawi for some time, and I was also with the Cameroon University of Health Sciences, and also the Longo University of Agriculture and Natural Resources. So I sit at the intersection of the academia and the civil society. Right? Okay. Somebody say something. All right. So Mitch gave you some specific figures and stuff, and one of the things that he said was, well, on the education statistics, we couldn't really find something that's comparable to Scotland because you expected to complete your primary education, right? But I'm sure there's some stories you can actually tell us about Scotland, and I'm interested to know. Just to tell you, I only came to Scotland for the first time, leaving Africa, last September. Okay? Anybody here has left Europe before?
Me.
You've left Europe before?
No, I came to Scotland only 7 months ago.
7 months ago.
So, yeah.
Somebody like me, sort of, right? Anybody here has been to Africa? You have. Only one person. So most of you are like me too. So I think it's good. But I'm good. But I want to hear something, a little bit, just some 30 seconds. I've given you some pieces of paper. There's something written on it. I want you to just tell me something I need to know about those people in Scotland. Just in a few words. 30 seconds. Quickly. Anything you know. Anything you can think of. Just tell me. Anything in 30 seconds. Something quick. Anything.
Good.
Okay. Yeah. You want to start? Yeah. What do you have?
I've got an ill pregnant woman.
Oh, an ill pregnant woman. Okay. Tell me.
They'd probably be able to get like faster appointments from the NHS,
Mhm.
and to, they could probably get like priority.
Right. Okay. That's interesting. They'll get more priority and stuff. Okay. Good. Anybody else wants to say something? What do you have? You have the fisherman. Tell me what you know about the fisherman in Scotland.
They go on boats.
The what?
They go on boats.
The gold bots.
Yeah, and then like, they have like these big like it's like they have like big nets and stuff, and they
Right.
get out of like fish baskets.
Okay.
And they sell them
Are usually young? Are they usually young people or older people?
older.
Older people. What do you have? Okay. Tell me something about somebody like that from here. They work with children a lot. Are nursery schools here owned by individuals or the government? You're not sure? Okay. What do you have? There's something else. Border district restaurant owner. Can you tell me something about that? You have borders here, you have restaurants here. Yeah, so yeah, definitely you have a guy like that.
Like, own like the restaurants and they like take people.
Okay, okay. There's a few more.
Teenage girls in primary school.
The teenage girls in primary school. What can you tell me about that?
Doesn't really happen in Scotland.
It doesn't really happen here? Wow. That's a difference. You can't have a teenager in primary school? Okay. You have something there. Oh, yes. No, here.
They
That one.
Not a black one.
Oh yeah, there's something there. Who do you want to tell me about? I gave you a blank.
Oh, yes.
Who do you want to tell me? It's blank, so you have an option of picking anybody. Come on. All right, fine. So I just want to share a little bit about Malawi specifically, but my focus is going to be on something that affected the whole world, COVID, right? Yeah, COVID-19. Okay. The reason I give you those pieces of paper and the different people is because I wanted you to have a picture of who we are talking about. I want to talk about COVID, but I'm not going to talk about the disease. I want to talk about those specific people, all right, for you guys to understand the differences and the similarities that we actually have between Malawi and Scotland, okay? So COVID was a global issue, right? A global pandemic, isn't it? Yeah? Yeah?
Yeah.
I expect responses, guys. Come. I can just be talking on my own. COVID was a global issue, isn't it?
Come on, guys.
Come on. Okay. We know this from the news. We saw it on TV. Everybody was suffering those, you know. But now the thing is, whatever it is we know about COVID, we know it from the media, isn't it? We know it from, I saw some of you were doing some literature search and you're writing things about Africa and all this, right? It's about the stories. It's about the stories that went out there. But now my question is, you know, we had COVID as a crisis. Whose crisis was it? Okay? Who was talking about it? I'm only using COVID as a case in point because there's a lot of issues that I think you're discussing in your classroom that are global in nature, isn't it? But what I want you guys to understand is that as much as they're global in nature, you need to have the understanding that they affect societies differently, right? They'll affect countries differently. Even in those countries, they'll affect individuals differently, okay? Because everybody has a story to tell. Every country has a story to tell, and these individuals also have a story to tell. In Malawi, when COVID-19 came, it was a shock, same as every nation, right? But here's what happened. Those certain measures that came through, I'm saying they came, not that we developed the measures really, no, they came from somewhere else, you know. Poof, your guys need to close your borders. Oh, your guys need to close your markets, okay? Your guys need to stop gathering in large numbers. Your guys need to close your schools. Schools were closed here as well, isn't it? When the schools closed, I'm sure you were also in school because that's a few years ago. How did you spend your time at home? Online classes and stuff like that. It's really cool, nice. But the reality for the teenage girl in Malawi is when schools closed in the rural Malawi, they went home. It was nothing else they could do about education. That's it. Because the reality is they don't have access to computers in the way. Let alone access to electricity is very limited. My colleagues here are going to talk about the experiences of the young girls in Malawi in general, and me just share some statistics. We're already coming from a space where we've been dealing with early marriages and poor access to education, low enrollment rates, and now COVID comes. First thing we do is closing down schools. And this girl is no longer going to school, they're back at home. The reality was, in that time, because of such measures, a lot of girls actually, we had a huge impact on the early marriages. Because they just went home, there was nothing much to do for them anyway. There was no online learning, there's no other form of engagement, nothing. Even the NGOs that are working day in, day out, receiving the support from other countries to deal with these issues, that time aid was affected, isn't it? Money was not coming through to support those work. Even community engagement and mobilization was limited. One thing. The fishermen. With the coming in of such a pandemic, with the measures that we have, okay? This guy lives by the lake and they depend a lot on people coming there to actually buy stuff. Their story was there was really nobody to buy what they sell. The tourism sector was closed. People no longer going to the lakeside. Okay? This guy will fish, but there's nobody to buy whatever they need. And so you find them sitting there, but their livelihood is totally affected. Interestingly, almost sadly, for the ill woman, you say they'll get a priority, NHS and get access, yeah? The story of one of the women that I actually met was that, they got ill at a point. They were pregnant. But it was difficult for them to actually go to the hospital for different reasons. One, for us, when COVID came, the patients were kept, or most of them were at the hospital, isolation day, right? And so within the communities, their thinking was, if I go to the hospital, this is where I'm definitely going to get COVID. So I'm better off not going there. Okay? So that woman was like, I have a cough, yeah, I have a cold, yeah. But I should go to the hospital? Definitely not. And our systems will not force you, will not track you down to say, oh, no, but you need to go to the hospital. No, it doesn't matter. If you want to go, you will go. If you don't want to go, you don't go. You can imagine what the reality was. Here's another sad reality that came. Not proud of it, but it is the reality. You guys have been talking about corruption and all these things, accountability and governance stuff, isn't it? It's real. The golden hand, that's what I call it. The golden hand is real, okay? When COVID-19 came, countries said, okay, let's put in resources and help the poor ones, all right? Malawi being one of them, Scottish government and other partners said, okay, let's give you this money. But now aid comes. If there's no proper accountability, chances are not the right people won't benefit much from it, isn't it? There's news that we got from all over that. Some of the money that came was being misused, people pocketing money and stuff instead of the people being supported by it. Why? Governance and accountability. My point being that you're going to be reading a lot, okay, about Africa. You're going to be reading a lot about different countries. You're going to be reading a lot about the relationships between the two different countries and what's going on in there. It'll be important for you guys to pay attention to who is telling the story about the issues that are affecting the globe, number one, okay? Number two, it'll be important for you guys to get a perspective on that and get to the local and contextual understanding of the issues that are there, okay? As a world now, we're taking pride in our differences, but also take pride in our similarities. Our differences are going to help us, to understand how can we support each other. There's things to learn from how things work here, or how people live here, that could probably improve the well-being of the people now, but it could also go the other way. All right? So, in a nutshell, as I said at the beginning, I referred to COVID as a casing point, as a crisis that came affecting the whole world. Okay? There's going to be different issues you're going to be talking about. The most current one, what's the most current issue affecting the world now? Everyone? Or anybody?
Sure, what was the question?
What's the current issue now that's trending, that's affecting the globe?
Guys, what's
One
going
big-
on in the
one
news
big
at the
issue.
moment?
What's going on?
Katie, what's quite recent? Victor, what's going on in the news?
Currently, there are a bunch of wars.
Is that the... Ready to answer?
Yeah.
Far south. Okay? So when you're looking at those global issues, make sure you're getting the perspective, getting to know who is talking about it and what the contextual issues that are and how those things relate. Okay? Great. Can I stop there? Is that okay? Come on, say yes. Okay, great. Thank you. So my colleagues will take over from there and yeah, I'll get questions at the end.